Hello, good people. How are you today? I hope that you are doing well and today finds you in perfect, wonderful peace. Today is the 28th day of June, which makes it the 28th day of Uterine Cancer Awareness Month. And as a uterine health advocate, I am committed to posting something every day during this awareness month regarding uterine health, uterine cancer, all things regarding the uterine. I also want to take this time to say thanks so much for your engagement with this channel, whether it's viewing the video, liking, commenting, subscribing to the channel, all the things that make you make engagement with this channel. So I say thank you. So I always like to, my disclaimer is always in the description, but I like to say it verbally. I am not a medical doctor nor in the medical profession. I am a uterine health advocate. So yesterday, I discussed or shared information about hysterectomy, what it was, why it's offered to women as a solution to their pain and discomfort that they're feeling or cancers that they may have been diagnosed with. And then I discussed treatment options that are out there, like the kind of surgeries and things of that nature. And today, I wanted to discuss, the recovery process after you have a hysterectomy. So you have a hysterectomy, what is your expectations in your recovery process? So I just did, a general search, what does recovery look like after a hysterectomy? So when you're recovering from a hysterectomy, it takes about 4 to 6 weeks for open abdominal surgery and 3 to 4 weeks for laparoscopic or vaginal procedures. Focus on, should be on resting, taking short daily walks to prevent blood clots, which is so important, and strictly avoiding lifting anything over 10 or 15 pounds. So these are the recommended things which a recovery should look like. And navigating your recovery, I found 4 things that you should be monitoring while you are recovering. The first one is your activity and movement. The second one is your pain and wound care. The third one is your diet and digestion. The fourth one is pelvic rest. So when we take a look at activity and movement, what does that entail? Walking. You should start walking short distances inside your home, and then slowly increase the distance, over time. This builds up, boosts the blood flow to start moving in that area and in your body. It prevents, like we said, or like I just said earlier, blood clots, and it prevents constipation and pneumonia. So getting up and walking is very vital to your recovery after a hysterectomy. So is rest. We don't know how, even when we have not had surgery and we are just going about our daily life, how important it is to have a moment of rest and to give our bodies that reset that it needs. So rest is very important, but especially after you've had a hysterectomy. So they say fatigue is common. So take daytime naps and listen to your body. The same way you listen to your body about all of those different discomforts, all of those different feelings that you were having, the heavy bleeding and the cramping. Listen to your body as you are at home recovering from a hysterectomy. They talk about lifting and exercise. They said avoid lifting anything heavier than a half gallon of milk or a gallon of milk. So, and avoid strenuous exercises like biking and jogging until you clear it with your doctor. I would, recommend, because I know that's going to be difficult to some people, especially if you just had a baby. But like they said, don't do anything until you clear it with your doctor. So maybe talk to your doctor before you have the procedure, kind of let them know what your life looks like. And so they can, you guys can develop a plan for success for your recovery. Because it's nothing like having a surgery and you don't do what you're supposed to do. And then you have to have an emergency surgery to correct whatever you did that you wasn't supposed to do. And maybe you have injured yourself even more. The last thing under activity and movement, they say do not drive for at least 2 weeks until you are completely off any kind of narcotic pain medication that you're on. And you can comfortably slam on the brakes if need be. Because if you think about it, when you're driving and you got to move that lower part of your body and slam on it. It could really, rupture the incision. It could just, cause all kind of things. So, don't drive for at least 2 weeks, and you'll know if you're capable and up to driving. The second thing is you're never navigating your recovery is your pain and wound care. So the medication. Stay ahead of your pain by taking the prescription medication on schedule as prescribed by your doctor for the first few days. Even if you start to feel better, take the medication because you may feel better, but remember your body needs to have its healing too. So the medication you're taking hopefully is bringing about healing that you can't even see to your own body. So if you have your incision. So you should gently wash your incision that you've had, depending on the procedure, the hysterectomy you had, right? If you have any incisions, I should say, you can, carefully wash those in the shower. They do not recommend that you take any baths or submerge yourself in any hot pools or tubs until you are cleared by your doctor. The third thing under the pain and wound care is comfort measure. Hold a pillow over your abdomen area while coughing to support your belly and decrease the pain. Wear loose fitting clothes and seamless clothing that does not rub against your incision. And I totally agree with that. I think if you're going to have this type of procedure, then maybe your leggings may not be the best thing because they have the waistband, that goes across like that. So maybe invest in getting some slip-on gowns or something like that you can just slip over yourself. That's something that's loose and free that will, not cause you any kind of discomfort while you're at home recovering. The third area they talk about is diet and digestion. They talk about how important it is for hydration and fiber. They're saying that you should drink 8 to 10 glasses of water daily and eat a rich fiber diet to prevent constipation. They talk about bowel management during this time. Anesthesia, when you're under anesthesia during your hysterectomy, and pain meds often cause constipation. And so to manage this, they say that it is recommended you should get some stool softeners or gas relievers just to have them on hand just in case you have this. And this was from, I guess there's a Reddit hysterectomy community. Reddit, I think that's Reddit. I've never been on it, but I'm very familiar with the platform. So on Reddit, there's a hysterectomy community, and that is what everybody was saying, according to this research, that you should do to manage your bowel movements is to have stool softeners and gas relievers on hand for yourself. I would also talk that over with your doctor to make sure that any kind of medication that they have you on doesn't counteract with any kind of stool softeners or gas relievers. So talk that over with your doctor. And then they say diet. Stick to small, easy to digest meals and avoid spicy and greasy foods in the first week. I think if you're going to have a hysterectomy, if possible, maybe make some meals for yourself ahead of time that you can eat and maybe just quickly defrost and, heat up so that you don't have to, do all the prepping and cooking as well, which can be very tiresome as you are supposed to be recovering and resting. The last area that you should be monitoring while you're recovering from a hysterectomy is pelvic rest. So you might see, they said it's vaginal discharge. So you might see light bleeding, dark brown discharge can be up to 6 weeks after you've had this procedure, and that's normal. They said don't use tampons, use sanitary napkins. And they say for your pelvic rest for 4 to 6 weeks, do not insert anything into your vagina, including tampons, douches, or having any kind of sexual intercourse. So that is giving your pelvic a rest. Because remember, you just had surgery, removal of your uterus. So it's a very serious matter. So you want to make sure that you're doing everything that you can because you want to recover healthy and have a better quality of life. And that's why you chose to have the procedure or was recommended to you as well. So during the time that you're at home during recovery, they do mention there are some times that you should, kind of be alarmed and maybe call your doctor. If you're experiencing any kind of fevers, chills, or severe nausea if you're nauseous, and you're vomiting, then a severe case of it, then you should call your doctor immediately. If you have vaginal bleeding that is heavier than a normal period or has a foul odor, you should call your doctor. If you have any red hot or draining fluids from your incision, you should call your doctor. And if anything is severe or worsening stomach pain or pelvic pain, then you should definitely call your doctor. Anything that you think is out of the abnormal, you should call your doctor. I think, I'm just going to say this. I always say that I think you should work with your doctor on everything. If you and your doctor decide that a hysterectomy is the best option for your healing plan, then hopefully you all will work on the best option as well for your recovery plan. Because it's very important, as you see, because you want to allow your body to heal, you want to allow your body to rest. This was a major, decision that you made for your to have a better quality of life. And so you should give yourself the proper rest, the proper pelvic rest, nutrition, and diet that you can. So I think working with your doctor, pre-hysterectomy, and then the procedure, and then post hysterectomy, so that you'll know and how to manage your recovery. So one of the things that I was curious about during when a woman has a hysterectomy, what happens to her body? Like, what happens with that? And so after hysterectomy, the space left by the uterus does not remain empty. And that's kind of what I was wondering. Does that space kind of remain empty? So it says your intestines and your bladder naturally shift and gently settle into the vacant area. Because a healthy uterus is relatively small, they said it's about the size of an apple. And so the repositioning of those two, your intestines and your bladder, is minor and you don't really feel it or notice it. Some of the internal changes that are happening are four that I found, which is, we just talked about the organ setting. Your small intestine are highly mobile and will naturally fill in the majority of the new space. And your bladder also drops slightly downward to fill in the rest of the void. So it's your small intestine and your bladder that is going to be shifting and moving into that very small space. So there's also tissue stabilization. Your surgeon, and you should ask your doctor about this too, your surgeon will close the top of your vagina to form a vaginal cuff. Over the weeks following the procedure, the body forms scars tissue to securely hold everything in its new position. So this is saying that this sounds like after you have your hysterectomy, that your doctor sews up your vagina to make a cuff, so that everything that's moving around can get an opportunity during those 4 to 6 weeks that you're resting to get settled in its new place and not move any kind of way it doesn't need to move. But this is something I definitely would talk to my doctor about, asking them, do they do the vaginal cuff depending on the type of procedure, the type of hysterectomy that you actually have. Okay. The other thing they talk about is relief from pressure. So after you have a hysterectomy, if your uterus was enlarged by, due to fibroids or anything else like that before the surgery, having this surgery can take the pressure off your bladder and rectum area, potentially making bowel movement and urination more comfortable in the long run. So you will see a difference in the pressures that you normally felt because you had this surgery. You will no longer feel those type of that kind of pressure. And it says that during the first weeks of recovery, it is completely normal to feel a mild pulling, pressure, or fullness in your lower pelvic as your organs adapt. So it's normal to feel something as your organs adapt to, the no longer having the uterus, and then the small intestines and the bladder moving into the new place. So, having a hysterectomy too, so you'll know, can shape your body. If you had, like they said, it doesn't change your skeletal muscles, that'll look the same. But if you had a large fibroids and, protruding uterus, once that's gone, your body will change to, I guess, represent the newness of not having that come out so much. So there'll be some hormonal shifts probably, and then you'll probably notice the difference in yourself as well. So specific changes that you can look out for, though, are three of them. So in the abdomen area, this was also on Reddit. Hysterectomy community reported that a flatter stomach after surgery, especially like I was just saying, if you had an enlarged uterus due to fibroids, pushing out your stomach or something else pushing out your stomach. Now that you don't have the uterus, you will see it. Your stomach is flatter than it was before. I don't know if you have a six pack, but it'll be flatter. Um, so you can see that, and some people experience post surgical belly where there's swelling and things of that nature. But I'm sure over time, as you're resting and healing, that swelling probably goes down. They also talk about you can have hormonal weight distribution, which means if your ovaries were removed alongside with the uterus, you will experience sudden surgical menopause, which is a drop in your estrogen and can slow your metabolism down and cause your body to store more weight than usual. And of course, you'll have more belly fat than hips and thighs. Are you like, oh my God, why do you always want to go around the belly? I mean, my goodness. That's what I want to say. And then also, what I thought was pretty interesting was posture and core support. The uterus helps support internal organs and the pelvic floor. And after removal, a weakening core can slightly impact your posture, making the lower back or the belly look and feel slightly different. So these are just some things that you just need to be on the watch for, because I just was really curious as to what happens to the body after such a impactful surgery in the uterine area. So again, I highly recommend that you work with your doctor on the best recovery plan for you and your lifestyle. Remember that we're all different people and our healing journeys is going to be very different. The choice that I choose for myself may not work for you. The choices you choose may not work for another person. So let's just tell you and be honest with your boss and with your doctor, and tell them about your lifestyle. Maybe you're a woman that just had children, so you have kids that are accustomed to jumping on you and being around you, and you don't want to show them any sign of rejection. So, having those tools in place so that you can still get your recovery, but still show your children love. Or maybe you are, depending what you do, you lift up heavy stuff. So everybody's lifestyle is different. So when you're making a recovery plan with your doctor, it's important to give them your lifestyle so they can be realistic and you can be realistic of what that should look like for you. So I always say I tell people, women, it's time for us to take our cape off. If you need help, ask for help. Share with family and friends the expectation of the recovery, and so they can assist you in the best way for the 4 to 6 weeks that you're at home recovering. Maybe somebody might make meals, maybe somebody might go, hold you up as you're walking around, or maybe they might just be there to ensure that you're resting and they're just there with you. Even if you fall asleep and you have kids, at least someone is there. So if you can, or if you have the opportunity, I know community is not available to everyone, but if you have the opportunity to have a community that can be of service to you, then reach out. And if you feel like you don't have a community, you'd be surprised where you'd find help at. Maybe even talking to your doctor. Just, if possible, I hope that you can, take the cape off and let somebody else do something for a change while you're resting and recuperating. I also feel that during any type of surgery, it's important because your body has had a major impact to it with the incisions, the cutting, anesthesia, all of that. It's important that we do rest. It is important that we do take the medication that they give us for healing. It is important that we eat the foods that they strongly suggest. And although it may seem tough at that time, think about that you made this very impactful decision to have a better quality of life. Or maybe this was the first decision or the first option, the last option, the only option for you to have a better quality of life. So, you think about all the years that you suffer, resting and recuperating for 4 to 6 more weeks is not that difficult when you think about it in the long run, how much better quality of life you should have after having such a procedure. So I highly encourage you to really take the time to rest and recuperate during the 4 to 6 weeks. So I have 4 points of reference for you, articles of reference, and they will be in the description. The first one is from the American College of Obstetricians and Gynecologists, and the title is called Recovery After the Hysterectomy, What You Need to Know. The second one is from the Cleveland Clinic, and this is from May 2024, Hysterectomy, Surgery Type, Side Effects, and Recovery. The third one is from Dana-Farber Cancer Institute, Recovering from Your Hysterectomy. And the fourth one I put down here is just the Reddit hysterectomy community. I'm sure that there are probably tons of communities out there that you can join and at least hear what people are saying and get an idea and to manage your expectation as well, even probably before you even, have the procedure, if you're thinking of having the procedure. So I hope that these last 2 days have been very helpful for you. Like yesterday, speaking on what is has hysterectomy and your options, for having them. And then today, letting you know what your recovery should look like. My whole point is when it comes to uterine health, I want us to be all healthy and whole in every single area of our life. And if we make a decision to have a surgical procedure, we need to also make the decision to develop a plan for a very positive, effective, and wonderful recovery. So until next time, I hope that you have a great and fantastic day. Talk to you soon.